Welcome to the Nurse Midwife service at Hennepin Healthcare. Thank you for joining us today for an introduction to our program. You may be expecting a new addition to your family or making plans to grow your family. This may be your first or fourth baby. You may be excited, nervous, or feeling overprepared or underprepared. These are all normal feelings.
Aliciana.
At Hennepin Healthcare, our care is centered around you and your baby. We believe that pregnancy is a special time, and taking your birth journey into your own hands is empowering. We're here to ensure your experience is not only safe and satisfying, but also deeply rooted in your choices, spiritual and cultural beliefs, values, and traditions. In this video, we'll guide you through what we do here as midwives. From prenatal care to high-risk pregnancy management, labor and birth support, and postpartum care. If you have been considering having a midwife as part of your birth experience, you've come to the right place. Thank you for letting us be part of your story. Our history. Started in 1971, our nurse midwifery program became the first hospital-based midwife service in the state. In the late 1960s, Margaret Hewitt, who was an experienced OB nurse along with her colleagues, recognized an unmet need for person-centered pregnancy and birth care in the Twin Cities. HCMC conducted focus groups asking community members what they wanted their birth experience to look like, and from those learning sessions, the midwife program was established. Our program provided an opportunity for families to give birth in a home-like setting, involved partners in the labor and birth process, and roomed infants with their families after birth. All of this is standard care at Hennepin Healthcare today. We honor our groundbreaking 50-year history that still informs the person-centered approach we use today. We're dedicated to health equity and ensuring that all people are listened to and receive excellent care. We acknowledge the history of racism in maternity care, and we actively strive to counter that history with anti-racist care. Hennepin Healthcare is proud to have cultural navigators who will ensure that your cultural beliefs and practices are an integral part of your care. Our cultural navigators represent African American, American Indian, Somali, and Latina communities. What is a midwife? Certified nurse midwives, CNMs, care for women throughout their life, including during pregnancy, labor, and birth. Midwifery practice focuses on your healthcare needs, including family planning, pregnancy, childbirth, postpartum care, and other gynecological needs. Midwives are advanced practice providers with specialized training and experience in midwifery, which means care of people who are pregnant, laboring, giving birth, and in the postpartum period. They can prescribe medication, perform medical procedures, and provide other interventions when medically necessary. Midwives believe in not intervening when labor is progressing normally, but are skilled in using interventions when needed to keep patients and their babies safe and healthy. Patients tell us that they appreciate midwife care because of excellent education, more time during visits and in labor, and involving you in all healthcare decisions.
Conoce a las parteras.
Meet the midwives.
Meet the midwives.
Lakulan umulusoyin ka.
Meet the midwives.
Meet the midwives.
Meet the midwives. We have a large team of 20 midwives. Our experience ranges from those who have just recently completed their education to those who have been attending births for 20+ years. We have midwives who are fluent in Spanish and Somali. We recognize strength and diversity in our work and in the diversity of the communities we serve. With such a large team, you may not see the same midwife at every prenatal visit. This might be intimidating, but don't worry, we work as a team. We also meet as a group twice a month to maintain our strong team connection. Of course, we all have different personalities, but the care you receive will feel consistent. Our approach to labor and support. The midwife team has access to tools and resources to make you comfortable during labor. For comfort, we have aromatherapy, birth balls, birth stools, hydrotherapy, squat bars, and more. For medicinal pain relief, there is the option for IV pain medications, nitrous oxide, or an epidural. If you want a water birth, we will provide a tub and the support you need. We know how important it is to feel and be supported. If you want family, a partner, or any loved ones involved in your care, we welcome them. Another way to get support is having a doula. A doula is a trained labor support person, and our midwife service encourages you to work with one. Doulas provide an extra layer of care and supports, like massage or helping with position changes, as well as emotional support and encouragement for you and your partner. Research has shown that doula care leads to higher rates of vaginal birth, less use of pain medication in labor, fewer babies needing NICU care, higher success at starting breastfeeding, and higher rates of satisfaction with the birth experience. Many doulas work for themselves, and you would meet with them before birth. Another option is to use our free on-call doula program. When you request a doula, they will support you during labor and birth. As a teaching institution, we are dedicated to educating future midwives. The student midwives we work with are always paired up with and supervised by a staff midwife. Many of our midwives were students with our service before they joined the team, so we see how important it is that we teach the next generation. Our students can provide extra support and education during your visit. We believe midwifery care is holistic, involving both the body and mind. You might have a pre-existing mental health condition or develop one during pregnancy or after you birth your baby. If you need mental health support, you can see a psychiatrist or psychiatric nurse practitioner who specializes in treating pregnant and postpartum patients. You can also enroll in the Mother-Baby program at our Red Leaf Center for Family Healing. This program focuses on group-based intensive mental health support for pregnant or postpartum patients and is the only program of its kind in the region. High-risk pregnancy care. Most of the time, pregnancy and birth are straightforward, but sometimes complications arise. A high-risk pregnancy is associated with an increased likelihood of complications for the pregnant person, fetus, or both. These complications can arise due to various factors, and it's essential for healthcare providers to monitor and manage high-risk pregnancies carefully to ensure the best possible outcomes. Some examples of high-risk pregnancies include being pregnant with twins, high blood pressure, diabetes, or if you plan to have a vaginal birth after 1 or 2 previous cesareans. We have been trained to independently manage many higher-risk conditions. We also work closely with our OB/GYN colleagues to manage certain high-risk conditions as needed. This partnership means patients can often receive care from us even when they may not have had access to midwifery care at other hospitals. Postpartum care. We are committed to you and your growing family's health after you give birth. As a baby-friendly designated hospital, all staff members are trained to support breastfeeding. We also have a team of lactation consultants who can provide additional education and support. In the hospital, your baby will be cared for by our pediatrics or family medicine team, and we have a Level 3 newborn intensive care unit should your baby need extra care. Connect with us. After you go home from the hospital, you will continue to receive care from your midwives for routine postpartum visits, including family planning. You can also continue care with our lactation team in addition to your baby's routine visits. We also partner with midwife colleagues who provide care in the community. If you're planning to give birth at home or a freestanding birth center but need to transfer to a hospital for any reason, our midwife team can provide care for you. We accept transfers during your pregnancy, labor, or after birth. We have community clinics close to your home or work for convenience in your busy life. When you're ready to give birth, our midwife team will be there, providing care at our labor and birth space at HCMC Hospital. Our midwife team is located at one of 7 clinic locations: Brooklyn Park, downtown Minneapolis in our clinic and specialty center, East Lake, North Loop, Richfield, St. Anthony Village, and North Point Health and Wellness in North Minneapolis. We also provide care over video or phone. These visits are best for routine prenatal visits or the postpartum follow-up visit after the birth of your baby. Thank you for taking this journey with us today. Continue your virtual tour of our space and watch videos of individual midwives at hennepinhealthcare.org/meetmidwives. We look forward to being a part of your birth experience.
We look forward to seeing you soon.
Meet the Midwives.
Conocer a las parteras.
Meet the Midwives. Meet the Midwives.
Conocer a las parteras.
Meet the Midwives. Meet the Midwives. Meet the Midwives.
Meet the midwives.
Meet the midwives.
Meet the Midwives. Meet the Midwives. Conocer a las parteras. Meet the Midwives.